Hi, my name is Emily. I'll be your nurse today. I'm going to be doing your head to toe assessment. Is that okay? Okay, can you tell me your first and last name?
Megan Canada.
What's your birthday?
11/10/99.
Okay, can I see your bracelet for just a second? Okay, so that's verified. I would, at this point, take her vital signs, assess her for pain on a scale of 0 to 10, with 10 being the worst pain she's ever felt. I would have her height taken and her weight taken. And I would also provide for privacy, but we're in an enclosed room, so I don't need to do that. And then I would also perform hand hygiene. But the first thing we would do for the head to toe is I'm going to go ahead and assess your skin. So is it okay if I see your hands for just a minute? So she has smooth, even coloration with no discoloration, no bruising, no lacerations. Her capillary refill is less than 3 seconds. She has no clubbing of her fingers. She has warm hands. Her hands are nice and dry. So she has pink, warm, and dry hands. The next thing I'm going to assess is her texture. So she has elastic skin with no dehydration and good and nice skin turgor. The next thing I'm going to assess is her head and face. So I'm going to first assess her cranial nerves 5 and 7. So this is trigeminal and facial. And so I'm going to take a cotton ball and I'm going to have you close your eyes, and when you feel me touch this with your face, just say okay, all right?
Okay. Yes. 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 Yes.
Okay, very good. So she was able to feel it in all parts of her face. Nice, even, and bilateral. The next thing that I'm going to do is assess her sinuses. So I'm going to palpate on your sinuses, and if you have any tenderness, let me know, okay? This is her maxillary sinus. So do you have any tenderness? Okay, and this is her frontal. Do you have any tenderness? Okay, and the next thing that I'm going to do is assess her lymph nodes. So I'm going to palpate your lymph nodes. Is that okay? Okay, and if you have any tenderness, then let me know, okay? So here's the preauricular, postauricular, occipital, submental, submandibular, jugular, gastric, superficial clavicular, the deep cervical chain, and posterior clavicular. And do you have any pain? Okay. And the next thing that I'm going to do is assess your eyes. So as you can see, she doesn't look like she has any drainage of her eyes, and they don't look pink or irritated. I'm going to test you with your visual fields first. So we're going to start with the confrontational test. So I'm going to have you look here for me, and then you're going to look behind me. Okay, hang on. Okay, I'm going to do the confrontational test. This is cranial 3, which is ocular motor. So I'm going to have you cover your eye with your right hand.
Which one?
Sorry, your right eye with your right hand. There you go. And then when you can see my fingers, let me know, okay?
Okay. Okay. Okay.
Good, and we're going to do the other side.
Okay. Okay. Okay.
Okay, very good. So she was able to see in all 6 cardinal directions. And again, that tests cranial nerve 3, which is the ocular motor. The next thing we're going to do is test her extraocular movement. And so this tests cranial nerve 3, 4, and 6, which is the ocular motor, trochlear, and abducens. So I'm going to have you just follow my finger with just your eyes and try not to move your head, okay? Very good. So she had symmetric eye movement with no difficulty in following my finger without moving her head. The next thing I'm going to do is do her pupillary response accommodation. So this is where I'm going to have you look at my nose, and then when I say okay, I'm going to have you look at that fan for me, okay? So look at my nose, look at the fan, look at my nose, and look at the fan. Good. So her eyes constricted upon looking at my nose because it was closer, and they dilated when looking at the fan because it was further away. The next thing I'm going to do is do her Hirschenberg test, and this is also called the coronary red light reflex. So I would usually use an ophthalmoscope, but we don't have this, so I'm just going to use this light. But I'm going to have you look just straight at my nose, and she should have an even red pigment on the same exact area of her pupils. Very good. The next thing I'm going to do is her pupillary light reflex. So this is test cranial nerve 2 and 3. So this is the optic and ocular motor cranial nerves. So I'm going to have you again just look right here for me. Very good. Very good. So her pupils went ahead and constricted upon the light entering her eye, very symmetrically upon both eyes. And the next thing I'm going to do is I'm going to give you this Rosenbaum chart, and I'm going to have you hold it 14 inches away from you. Very good, just like that. And then I'm going to have you read the lowest line you can on that, okay?
A, B, C, 1, 2, 3.
Very good. So that, she read line 14, so that's a 14 out of 14, which is a normal result. And that tests her cranial nerve 2, which is the optic. And the final test I'm going to do for the eyes is I'm going to look at your conjunctiva and your sclera. So I'm just going to have you look at the ceiling for me and just hold real still. Very good. So she had pink moist sclera and conjunctiva with a little white over it, which is normal. And then we're going to go ahead and move on to her ears. So is that okay if I move on to your ears? Okay. So as you can see, she has bilateral piercings, which don't appear to be swollen. Is there any tenderness upon palpation? Okay. I'm also going to fill up your ear. You let me know if you have any tenderness, okay? Did any of that hurt? Okay, very well. And so I'm also going to take the otoscope, and I'm going to look at your eardrum, or her tympanic membrane. So for the adult, I pull up and back. So I'm just going to come on this side of you. Pull up and back. Very good. And I would do this to both sides. Up and back. Very well. And her tympanic membrane is translucent, gray, and shiny, which is normal. It's a pearly gray. And then the next thing I'm going to do is do the voice whisper test. So I'm going to have you just stand up if that's okay. And I'm just going to have you stand just right over here. Okay, so I'm going to have you take your finger on your right ear, and I'm just going to have you just go like this to your ear for me. Very good. Okay, so I'm going to have you turn around for me, and you're just going to do that. And then you're going to repeat back to me what you hear, okay?
A, B, C, 1, 2, 3.
Very well. And I'm going to have you switch hands for me.
A, B, C, 1, 2, 3.
Very well, and you can take a seat for me. And that tests the cranial nerve 8, which is vestibular. Okay. And then next I'm going to move on to your nose. So I'm just going to have you go ahead and just look straight at me. And I'm just going to feel your nose, and you let me know if you have any tenderness, okay? Any tenderness? Very well. And then I'm going to take the ophthalmoscope, and I would insert it into her nose very gently, and just take a look of her nasal mucosa. So I'm going to have you tilt your head back just slightly. Very well. So she has moist pink surfaces of her nasal mucosa. She does not have a deviated septum, and her turbinates will be very tender if touched, but they look nice and normal with no polyps. The next thing that I'm going to do is I'm going to test cranial nerve 7 of your face, and I'm just going to have you puff your cheeks for me. Good. And can you smile? Good. Can you frown? Good. And raise your eyebrows? Very good. So as you can see, she had even and symmetric movements to her face as well. And then the final and last thing I'm going to do for her nose is I'm going to test your sense of smell. So I'm going to have you close your eyes, and when I say okay, I'm going to have you tell me what you smell, okay? So give me just a second. So go ahead and close your eyes. Okay, go ahead and smell.
Mint.
Very well.